Hello, my name is Dr. Chandni Nakum and this channel is dedicated to all things teeth and dentistry. I'm a dentist based in the UK and I enjoy making people smile, not only from the outside but also from within. I want all of you to understand your teeth better, so I'm trying to make more complex information into bite-sized, simple and an easy way to understand more about your teeth. Today we are talking about Invisalign. If this sounds good to you, then please click that subscribe button and also hit that thumbs up. What is Invisalign? Invisalign is the treatment of straightening teeth, but it's not the typical traditional way of straightening them. For example, in your head, you're probably thinking of the little metal squares that sit in the middle of your teeth and then a wire that runs across them. That's not how Invisalign works. Invisalign works by a series of removable clear aligners. There are no brackets and no wires. So what are aligners? Aligners are a clear, flexible material made for Invisalign only. They are latex-free and gluten-free and they fit snugly around the teeth, making them virtually invisible. How does Invisalign straighten your teeth? Your dentist will make a treatment plan for you called a ClinCheck, which maps out the exact movements of every tooth. Your clear aligners will then be manufactured so that they produce the right amount of force on the right tooth at the right time. You will then work your way through a series of aligners which will eventually move your teeth at each point, and your dentist will be there to monitor your progress as well. What are the benefits of Invisalign? Invisalign clear aligners are virtually invisible and some people may not even notice that you're wearing them. What's really good about the aligners is that they are removable, which means that you are still able to eat and drink normally. And it also means that your oral hygiene is not compromised because you're still able to floss and to brush them properly. Am I guaranteed straight teeth with Invisalign treatment? Every smile is unique, which is why Invisalign's treatment will always start with a consultation first. During your consultation, your dentist will go through what Invisalign treatment can do for your smile. It's important to remember, however, that we can't always guarantee a particular outcome, but we always encourage you to share your treatment goals with your dentist so we can make the best smile possible. What should I expect during my consultation? During your consultation, your dentist will go through your teeth straightening goals and also examine your smile so that they understand your specific needs and your wants from your end smile as well. The dentist might also encourage you to have a dental checkup and a clean before embarking on your Invisalign to make sure that there's no underlying issues or anything which could then cause risk during your treatment. How long does Invisalign treatment take? Invisalign treatment depends on multiple factors, like how complex is the case at the beginning and also how compliant are you with wearing your aligners. Usually we recommend that 20 to 22 hours a day is compliant enough to see tooth movement. However, tooth movement can also be slightly unpredictable, so it's important to wear those clear aligners for as long and as much as possible during the day and the night. On average, Invisalign treatment usually takes between 12 to 18 months, although you might be seeing some subtle movement in a matter of a few months. How often do you change your clear aligner? This depends on your treatment plan, but most dentists will suggest a week to 10 days to sometimes even for 2 weeks, depending on the tooth movement and even the tooth movement in the past. Purely because some of the movement that may have happened might be quite subtle or some of the movement might be quite quick, and so the movement and the time for the clear aligner may vary. How often do I need to see my dentist during the Invisalign? During the Invisalign, your dentist will usually schedule quite regular appointments, and the goal of these appointments is to ensure that your Invisalign treatment is progressing as planned. For example, your teeth are showing the same movements or very similar movements on your clean check. My dentist mentioned attachments. What are they and why do I need them? Attachments are small, tooth-coloured filling material which is placed in some areas of your teeth during your Invisalign treatment. Often some dentists will call them little buttons, and it's usually made out of composite, which is a filling material. The reason why these are used is because it will help your teeth to move in a certain direction and with a certain force. And this is what Invisalign uses to ensure that there is the movement that's required according to your clean check. Can I have Invisalign treatment for just the top teeth or the bottom teeth, or do I have to have it for both? Invisalign treatment is not set in stone. You don't have to have your top and bottom teeth done, and you can opt to have just the top or just the bottom. However, in my opinion, I always think it's best to have top and bottom done together, and the reason for that is the tooth movement becomes a lot more reliable. For example, if you're trying to move the top teeth one tooth forward in front of your lower teeth, because the lower tooth is in the way, it means that the top tooth might not go as expected, so it might not be able to almost jump over the bottom tooth. But if the bottom teeth are moving at the same time, it becomes a lot more predictable to time the movement more accurately. What happens after I finished my Invisalign, and are the results lifelong? So after you've finished your Invisalign treatment, it's usually very important to have some kind of retainer put on your teeth, and usually the retainer is lifelong. The reason for that is because there is always a small risk of relapse, which means that your teeth can move back, perhaps maybe not to the original position they were in, but they can move from the position that was the finished outcome after your Invisalign treatment. A retainer is very similar to perhaps a clear aligner, where you put it on your teeth. It's a mould that you place on your teeth, usually at night, and that means that it's the added security of your teeth not moving. Some also put on a fixed retainer, which is like a little wire that runs on the back of your teeth, top or bottom. Usually it's dependent on your dentist looking at your final outcome, and they will usually recommend both the fixed retainer, which is the wire, or just the removable one. It's best to have this conversation with them also. So that was Invisalign in a very small nutshell. I hope that you found it useful and it answered perhaps some of your questions. This was an intro to Invisalign. I will do an in-depth version for you guys soon. And just so that you don't miss it, please do click on that subscribe icon and also hit the thumbs up. Remember, as usual, if you have any questions, please do put them in the comment section and I will try my best to reply. Thank you.